Hello, friends all over the world. Good morning, good afternoon, good evening, depending on wherever you are watching me from. It's your mental and dental health experts again today. Today, I want to talk about what we call dental caries, the one that people know as hole in the teeth. This issue has brought a lot of persons to the dental clinic. It has taken a lot of persons to the dental clinic in so many unimaginable, terrible ways. Some come to the dental clinic crying, pains. In fact, once they come, they will start shouting, please remove this tooth, remove this tooth, remove it, remove it, remove it. At a time, they may not even know the particular tooth that is even actually paining them. That is how terrible the pain can be. And you see, this thing does not develop overnight. There are things that lead to this particular condition. One of them is when you don't take care of your oral cavity. You don't brush your teeth, you don't drink enough water, you don't floss your teeth, you don't use dental floss to floss your teeth, you use some harmful objects on your teeth, using your teeth to open the cork of a bottle, or using nails on your teeth, or any other harmful object on your teeth. Any of these things can cause some of these pains. But today I want to look at the kind of things that can lead to this tooth cavity or dental caries, as the case may be. You see, number one is our diet. Our diet cuts across both people who eat natural foods, who eat junks, snacks, sugary things, and all that. When we eat, anything we eat, whether it is natural or it is processed, there will always be leftover food particles in our mouth. It is just normal. And there are also bacteria in the mouth that we call normal flora. I'm trying to avoid using some jargons. I want to use words that anybody can relate to. So some of these bacteria, microorganisms in the mouth, that is like their home, their normal home, like the way you live in your house, your parlor, your room, your kitchen, everything. For them, that is just their own parlor, their room, their playground, and everything. Now, when we now eat, the leftover food particles in our mouth that hangs around our gum, our teeth, our cheeks, now becomes foreign materials to these microorganisms. For example, in your house, when you now have a visitor, so it's like the microorganisms now have a visitor. Now, the microorganisms, because they are there, will start feeding on those leftover food particles. And like every other living things, they are also living. So when they eat, apart from eating, the next thing, one of the things that living organisms do is that they excrete. So these microorganisms also excrete after they must have fed on those leftover food particles in our mouth. And part of their excreta is acid, is acidic. So this acidic compound, or element, as the case may be, now is very harmful to the teeth. It now begins to degrade the enamel. The enamel is the white part of your teeth, the one you see when you open your mouth, the hair, and you want to touch your teeth. That part is the one we call the enamel, and is one of the strongest bones in the body. So imagine if an acid can make that bone to have a hole. So you can imagine how powerful that acid would be. So we try to encourage people. That's why we say that after eating, anytime you finish eating, make sure you rinse your mouth with water, you floss, use dental floss and floss to remove every remaining food particles in your mouth. And if you are around where you have access to your toothbrush, you brush. That's why we encourage brushing twice daily, especially anytime we finish eating. That's why we say before you go to bed and immediately after your breakfast, so that there won't be any reason of leaving leftover food particles in your mouth. The point is, once you finish eating anything, be it anything, snacks, natural food, you drank juice, anything, as long as it is not natural water, as long as it is not just normal water, once it is anything that has additions, maybe food, soft drinks, wine, anything, there is something that you have left in your mouth, and that thing needs to be removed. Once it is not removed, you have presented a playground for the normal microorganisms who are just there resting in their bedrooms. So leaving those leftover food particles in your mouth have given them a playground where they will come and play. And when they play, one of the things they also leave behind is acidic in nature, and that acid is not good for your teeth. It will start causing issues, and that's when you say that your gums are bleeding, your teeth is shocking you, you have hole in your teeth. And I don't think it is always a nice experience for those who must have experienced that. So I encourage you today, please, anytime you finish eating anything, I mean anything, is it soft drink, is it wine, is it meat, is it rice, is it juice, once anything that has entered your mouth and that thing is not water, please get water and rinse your mouth. Floss, get a dental floss and floss your teeth. If you have access to your toothbrush and toothpaste, kindly use them. Just make sure that your teeth is free of any leftover food particles. And trust me, when you are intentional about this, you won't be part of those people that have teeth problem. And you'll always have reason to thank me later. So as I see you in the next episode, make sure that once you finish eating anything, even as you are listening to me now, make sure you rinse your mouth with normal water, floss your teeth, so that you don't leave any leftover food particles in your teeth. Thank you, and see you next time. God bless you.